In North America, over 2.5 million visits to the doctor a year is for constipation. As TCM practitioners, we are definitely here to help. Constipation is one of the most common complaints in clinical practice. Now, not everybody comes in for constipation specifically, but when we do a consultation and we ask about the bowels, a lot of our patients, let's face it, have some issue with constipation. It shows up in all ages, all patterns, and if we don't get the diagnosis right, no amount of acupuncture can budge and move the stools down the bowel and out the door. This is why today I am talking all about constipation. We're going to look at the most common patterns and their symptoms, their acupuncture points, formulas. We'll talk about lifestyle advice, diet, and supplement to really help ease constipation. We're going to look at the causes as well, because often chronic constipation has an underlying stress or emotional stress that's attached to it. Because, as a reminder, the large intestine is the organ that lets go. No more guesswork, just solid, clear tools that you can use in clinic tomorrow. Let's go. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I've been practicing acupuncture since 2003 and teaching future practitioners since 2008. So you're in good hands. Every time I go back to France to visit my family from Canada, this is a 10-hour plane ride from Vancouver all the way to somewhere in Europe, being Frankfurt, London, Paris, and then I have another plane to go to Geneva because I'm from the French Alps originally. So this is a long time sitting down doing nothing, plus the cabin pressure really creates constipation. So when I travel, my bowels don't move that well. This is why we could see that one of the causes of constipation is sedentary lifestyle. Now that's for chronic constipation. Acute constipation can happen again, like I said, when we travel, we're sick, we're laying down, or we're not eating, depending on what's going on. So today we're really going to focus on chronic constipation. The definition of constipation is difficulty in passing stools and or prolonged intervals between bowel movements. I have a patient that came years ago and she would have a bowel movement maybe 2 to 3 times a month. Yeah, sometimes not for 2 weeks. That blew my mind because it is so key to health to eliminate. Otherwise, what stays inside festers inside and can actually lead to toxicity, right? So it's really important that we move the bowel. Also, with old people, if there is no bowel movement, the blood pressure can rise. So it's really key for them to have a daily bowel movement. I remember my mom used to take track of her bowel movement daily. She had a calendar and then she would put yes, great, not today. Like she would put all every day, the comments. And my husband saw that one time and he said, "What does that mean? What is that great, not today? What is that?" And then she told him, she's like, "I'm keeping track of my bowel movement because if I don't go for 2 days, I get freaked out. So I have prune juice, apples, things to help me go." So my husband's like, whoa, that's a lot of information. But that's the point. With older people, it's even more essential. It's essential for all of us. But with older people, it can become really a trigger to blood pressure and other issues. According to TCM, the causes of chronic constipation can be due to stress, emotions or long-standing emotion, emotional trauma, diet, drugs, illnesses, and of course, lack of movement or lack of exercise. Constipation is often a symptom of the following Western disorders: hypothyroidism, depression, anxiety, IBS, diverticulitis, and other issues. Let's start to look at the TCM causes. Emotions can absolutely stagnate. Of course, the liver is in charge of moving qi. So when we're stressed, we're tense, we're tight, or if we're not moving, liver qi is not moving, and so stagnation can occur in the bowel, which creates constipation. Emotions like anger can create some heat and some stagnation and constipation. When people are very sad and grieve and cry a lot, they spend a lot of energy with the lungs, and the lung is not connecting to the large intestine at that time, and so there is no bowel movement. So that also can create constipation. Of course, like we said, chronic illness, drugs or medication can do that as well. Diet, if we lack fiber, hydration, and lubrication. So we're going to talk about diet in a minute. Those are the main causes according to TCM. I've talked in the past about my story about chronic constipation my entire life until one thing happened and triggered me to realize something that was stuck in me emotionally for many, many decades, and I was able to release it. If you haven't heard that story yet, I'll have the link for you below. Before we start looking at the most common patterns for constipation, let's see what we can do when it comes to ear point, because I love the ears, my favorite microsystem. The 3 points I would do for chronic constipation would be liver, because it moves everything, large intestine, of course, because it's affecting the colon, and Shen Men to relax the whole body. Now, if it was due to stress specifically, I would also add sympathetic. So we can play around, we could put 2 points on one side and 2 on the other. We could put seeds so the patient can go and stimulate. So this would be fantastic. Now, the second thing I wanted to say before we start to look at each pattern is sometimes making a diagnosis is not easy. We all know TCM diagnosis is the hardest part of TCM. Yep. So what do we do if we're not really sure? So let's talk about what are the main points to do no matter what. I think that even if we don't have a full understanding of the diagnosis, we can figure out if the person is more deficient or more excess in general. Yes, you're with me on that one. So if there is constipation, no matter if it's excess or deficiency, we want to do the digestive diamond. The digestive diamond, I've talked about it many times, is Ren 6, Ren 9, and stomach 25. And you want to needle it in the way the colon is flowing, which means from your right or the patient's right up and down to the left, down to the rectum, right? So we start at stomach 25 on the right of the patient, Ren 9, stomach 25 on the left of the patient, and Ren 6. So this is how we would needle. We can also massage it in that direction as well to help the patient. And we can show the patient how to massage it slowly in a circle for them to do this at home as well. So this, no matter what the diagnosis, is one of the best things to do. However, what about if the patient is a pregnant lady? We can't needle her belly, right? So we can't do that at all. So let's look at what do we do if it is due to excess or deficiency. We have to do stomach 36. Pregnant or no pregnant, stomach 36 is the commander point of the digestive system. So no matter what, it's going to be there. Now, if it's due to excess, stomach 37 is the lower Rossi point of the large intestine. So you would have to put this because it helps clear excess in the large intestine. Large intestine 4 is the yuan source point of the large intestine, and it helps move qi and blood, accompanied with liver 3. So I would do the 4 gates if it was due to excess, to try to move liver, qi, and blood with the 4 gates. Okay, so now we got those points, we're pretty good. Now, if someone is pregnant, you can do stomach 37, stomach 36, but you cannot do large intestine 4. I usually do liver 3 and gallbladder 34 to relax the qi to move. The best point also for constipation is Sanjiao 6. So Sanjiao 6 also relax the bowel specifically for excess. Doesn't work as well for deficiency, I would have to say. If it's a deficiency, kidney 6 is great and spleen 6 is great as well. So if it's a deficiency, I would do stomach 36 and then I would do spleen 6, kidney 6. Now, spleen 6 you cannot do during pregnancy, so we're going to omit that one. And usually during pregnancy, the constipation is due to excess, so it's a much easier thing to do. Yes? Okay, those are your basic points. Now, let's look at each specific common patterns when it comes to chronic constipation. The most common one is liver qi stagnation, and the person has a feeling of incompletion after a bowel movement. So they're constipated, they go and they feel like they weren't finished. And it is worse when stressed and worse at the week before prior to menstruation or at PMS time. Lots of gas, lots of bloating that feels better after bowel movement but gets worse as the day progresses. The person is of course irritable, maybe rib pain, PMS symptoms if it was a woman, sighing, tense, stress. The pulse is wiry, super easy. Now for points again, Like I said, you can do your basic points like your digestive diamond. You can add up Sanjiao 6, Sanjiao 5. You can do stomach 37, gallbladder 34, liver 3, large intestine 4. Those are all great points. Now you could add up liver 14 because it's the front moo point of the liver. You could do the back shu point like bladder 18, but it's not very convenient because we have more points in the front. So doing the front moo would be more useful. The next one is phlegm. Phlegm is really interesting because often we don't know the difference between phlegm and dampness. They have a lot of similarities, same tongue with a greasy coat, same pulse, which is slippery. They both have probably a foggy head, heavy limbs, poor concentration, poor focus, maybe greasy scalp, greasy skin, fatigue. All those things are very similar to phlegm and damp. However, when there's dampness, there is loose stools or diarrhea. With phlegm, there's chronic constipation, which when we have a bowel movement, it's sticky. It's formed, but sticky, meaning we need a lot of toilet paper in order to clean, right? So that's the phlegm. Also, the mind feels more clear and focused after the bowel movement. Now, again, we can do the digestive diamond. We can do stomach 37, stomach 36, but the best point for phlegm is stomach 40. That's what we want to do. Gallbladder 34 is a great point to move. Also, it moves dampness and phlegm as well. We can do liver 3 to help move the phlegm. When there's phlegm, there's stagnation. Pericardium 6 is great for phlegm as well. So you can play around. This is just a guide to kind of help you understand how we differentiate all the patterns, and then you can pick up your points. The next one would be food stagnation. Now, food stagnation often is acute, like after a big Christmas dinner and you feel so bloated. But for some people, it is a chronic thing because they overeat every single day. So now there's constipation alternating with smelly diarrhea. There's nausea, specifically after eating a big meal, gas, belching, burping, acid reflux. The tongue has a greasy coat because food stagnation leads to phlegm and a slippery pulse. So again, you could do your digestive diamond. You could do stomach 37 again because it is excess. Food stagnation is an excess pattern. Remember, stomach 37 is the lower Rossi point of large intestine, which means it's used for excess. We can do Sanjiao 5 or Sanjiao 6 because they both help when it comes to constipation. And of course, I would do Ren 12 because there's lots of nausea, maybe pericardium 6 to help with the nausea and the belching and the acid reflux. The next two are basically very similar. It's large intestine heat or heat in the large intestine. Or we can also talk about Yang Ming syndrome. Now, Yang Ming syndrome is more acute with sweating, very thirsty, fever, constipation, and very dark urine. So this is going to be more acute. So we're going to have to really clear the heat with large intestine 11, stomach 44. We can do the digestive diamond, of course, stomach 37 again, Sanjiao 5, Sanjiao 6, all those can be put in there. With large intestine heat, it is more of a chronic issue. We have chronic constipation with hard, dry stools, a red face, bad breath due to the heat, scanty dark urine, thirst, like big thirst for cold drinks, irritability, a red tongue with a yellow coat, and a slippery, rapid pulse. Now, again, you could do the digestive diamond, but now we need to clear all that excess heat, right? So stomach 44, large intestine 11, one of the best points because it's its own meridian, obviously. We can do stomach 37. I would put large intestine 4 because it helps clear heat as well, right? So there's a lot you can do. If you have my book, Chinese Medicine Treatment Made Easy, you can see the patterns with constipation, with the herbal formula, and the points. Remember, the points are just guiding points. Adapt them to each of your patient's issue. Does that make sense? Okay. Have you signed up to my weekly newsletter yet? It's completely free, and I share exclusive tips and tricks when it comes to TCM and acupuncture I don't share anywhere else. The link is below for you. Make sure you're on it so you don't miss out. Now let's look at deficiency formula. The first one, very common, is blood deficiency. I see a lot of women with this. It's constipation with dry pebble stools, dry skin, dry hair, pale nails, pale face, pale lips, poor memory, fatigue or poor energy, insomnia. This is the insomnia where you cannot fall asleep. Maybe anxiety, maybe dizziness as well, definitely a pale tongue, and a thin, choppy pulse. Remember, blood deficiency is always pale and poor. Poor sleep, poor energy, poor memory, and numb limbs or tingling and pins and needles, so poor circulation. Make sense? With that, we want to nourish blood. We are going to do stomach 36, we are going to do spleen 6, and then we can do the digestive diamond as well. I would also probably add up liver 8, and probably heart 7 to calm the mind. The next deficiency pattern is a qi deficiency, and this is going to be related to the lung. So it's kind of a long qi deficiency. We're going to have shorter breath, sweating during the day, weak voice, pale face, constipation with difficulty in passing stools, and fatigue after the bowel movement because it takes a lot of qi to strain and to push the bowel movement or the stool out. The tongue is going to be pale, maybe with teeth marks because it's probably affecting the spleen as well. And we're going to have a weak pulse, probably in the lung and spleen and heart area. This could happen to a lot of people that have asthma or a chronic lung issue like COPD. Now, again, we can do stomach 25, we can do spleen 6, stomach 36, Ren 6, right? Tonified Qi. That's what we want to do. And we can do the digestive diamond. Yin deficiency is the next common pattern. This one happens a lot during menopause in women that have constipation with dry, small, sheep-like stools. So very similar to the blood deficiency. However, the yin deficiency will have 5 center heat. Hot palms, hot soles, and hot chest area. Night sweats, insomnia. Now, this insomnia is toss and turn all night and waking up because the person is feeling hot. They will have red cheeks, maybe dizziness, red lips, dry mouth, specifically at night. Tongue would be red and cracked with a very scanty or no coat, and the pulse is thin, rapid. Now, again, we can do the digestive diamond every single time. We want to nourish yin, so kidney 6 is a great point for that. And then we can do stomach 36, spleen 6 as well. Now, we could also add a back shu point or front mu point of the liver and the kidney, because this is definitely more of a kidney and liver yin deficiency. So bladder 18 and bladder 23. And the last one, which is going to be a bit surprising, but happens a lot with old people, is yang deficiency with internal cold. So how is yang deficiency going to create constipation, right? Because we know from yang deficiency, specifically, let's say kidney yang deficiency, the main symptoms is 5 a.m. diarrhea or early morning diarrhea. So this is a constipation, meaning that the person does not have a bowel movement every day. But when they have it, it's very difficult in passing the stools. They have to strain and push, but the bowel movement is loose. It is not formed because there is yang deficiency. And because there's no fire, no energy, no yang, the person is going to feel exhausted after the bowel movement. They'll have cold bodies, specifically cold feet, because this is a kidney yang deficiency, maybe edema on the ankles, abdominal pain that feels better with warmth, low back pain that feels better with warmth, and a pale swollen tongue with a wet coat. That's a typical yang deficiency, and a deep, slow pulse. Now, this yang deficiency creates the internal cold. It's not the internal cold that created the yang deficiency. I hope that makes sense. Again, you can do the digestive diamond, but you also can do moxa on Ren 4, on stomach 36, on spleen 6, and then you can do front mu or back shu point of kidney and spleen. That would be really, really good. And large intestine, of course. So if you did back shu, it would be bladder 20, 23, and 25, which are the spleen, kidney, and large intestine. And if you wanted to do front mu, you could do liver 13, which is the front mu point of the spleen. Of course, stomach 25. It's part of the digestive diamond, which is the large intestine front mu point, and gallbladder 25 is the front mu point of the kidney. So here you go. That's a lot of points, and that's a lot of things to think about. But I really wanted to give you the most common. Those are not exclusive. By the way, all the information I share today comes from my book, Chinese Medicine Treatments Made Easy. It ships all over the world, or you can get the digital version, and it covers 160 syndrome and symptoms with all the acupuncture points, formula, ear point, and so much more. So many practitioners use this as their guide in clinical practice. It warms my heart. Get the hard copy book or the PDF version. The link is below for you. Okay, so we've looked at the patterns, ear acupuncture, and the causes. Now let's talk about what the patient needs to do in order to help themselves, because we are here to guide them and we are here to help them, but they need to do the work as well, right? Okay, I always say to patients, I'm going to help you to get to the top of the mountain. This is where you want to feel better. This is where good health is. I'll guide you up there, but you got to walk. I'm not carrying you, which means they do have to do their homework. So the first thing is we need to look at what the cause is. If it's lack of exercise or lack of movement, because maybe they work at a desk all day, they need to get up and move. Even if it's just to go for a walk for 5 minutes outside, or get up and walk around the office, come back, or have a standing desk, or something that gets them to move. And when they have their lunch hour, maybe make sure you go for fresh air and movement. That is key. The second one is stress creates a lot of constipation. So we need to find ways to relieve the stress. And for everyone, it's different. For some people, it's singing, dancing, going hiking. For me, it's being outside, hiking with my husband and my dog, going for a bike ride, going kayaking. That makes me happy and takes the stress away. So whatever helps the patient, we need to educate them. One of the big lifestyle change that I recommend to patients is deep breathing exercises. So many of my patients are shallow breather because they're so anxious all the time. We need to learn to take big, deep breath. A few times a day, big, deep breath, 3 to 4 times in a row, relax and go on about your day. But keep trying to do this to really mitigate the stress. When it comes to nutrition and diet, it is key to have a normal bowel movement. So, depending on the pattern, if it is a yin deficiency or a blood deficiency or anything that's more dry, we are going to recommend a lot more lubrication and hydration. What does that mean? Hydration means drinking and eating food that are high in water content, so high in electrolytes, like cucumber, watermelon, bone broth, soups, teas, anything that's going to bring a lot of nourishment to the body with a lot of minerals. The second one is lubrication. Not only we need to bring high water content to the body, we also need to lubricate it, which means we need food high in essential fatty acids like nuts, seeds, avocado, olive oil, flax oil, anything that is really good for the body and high in good fats. That has to be incorporated, because a lot of women in menopause will come and say to me, I drink tons of water and I'm still constipated. That's because you're not lubricating, right? Because in menopause, a lot of the body starts to dry. So we need lubrication, vitamin E, vitamin D, and food that is really high in fatty acids. So that's what we need to explain to patients, give them the guidance. Last but not least, let's look at supplements. Obviously, if there's chronic constipation, it would be really great to test and check out what's going on with the bowel. The patients can go and get lots of testing. However, in the meantime, supplements can be useful. For example, magnesium. Magnesium is great in relaxing the body, but also the stools and softening the stool naturally. There's a lot of different kinds of magnesium, glycinate, citrate, malate. We want to recommend the citrate magnesium. That's the best when it comes to constipation, because glycinate, for example, is great for stress and relaxing and going to sleep better. So it's really key to understanding vitamins and nutrients in order to educate our patients, because let's face it, they're probably going to Google and they're not going to know what the answer is. It's better if it comes from you. If you haven't checked out yet Dr. Alex's Vitamins and Nutrients course, I love that course. I learned so much from it. It is on our website at AcuPro Academy. I'll have the link for you below. Check it out, because it is so essential as TCM practitioners, because we did not learn that in school, to be able to guide our patients with the knowledge of understanding vitamins and minerals. Wow, that was a lot of information. As I said when we started, constipation is very common among our patients, and we can help. TCM is so amazing. I've had patients come in and they're like, after acupuncture, I have the best bowel movement. Woohoo! Acupuncture rocks, as always. Thank you so much for joining me today. Watch this video next, and no matter what, keep rocking it using TCM.